A second practical example. All is not as it seems, the case of perceived pain. Reasoning for networks and hubs also allows us to understand the problem and what the dysfunction is, something that is not always so obvious. For example, chronic pain does not pass if you block the pain areas devoted to touch and physical sensations. Conversely, you can reduce it and modulate it, acting on one of the most powerful integrative hubs of our nervous system, the insula. This structure is involved in several networks, from the previously mentioned salience network to all those that regulate attention, control, awareness of self-adaptation to the environment, and more. The insula can be helped in many ways, among others, in its pain-regulating activity. For specific advice, please refer to the video dedicated to this important hub. The vision for the network and hierarchies of influence also allows you to refine the action sequence. In some cases, this also means creating conditions to overcome resistance to change or to certain therapeutic techniques. We know that there are mental techniques that can modify the perception of pain. These are formed mainly through the dialogue between prefrontal cortex and anterior insula. If the insula is in optimal operating condition, mental pain reduction techniques will be effective. If not, you won't experience the same benefits. In other words, the prefrontal cortex, although fully functional, fails to bring its contribution if the insula, which in this network is the most important hub, is not in conditions to receive it. As a consequence, it is important to give priority to interventions that can regulate the insula and, only later, try to introduce cognitive techniques. Like this, we avoid long intervention times and a feeling of frustration to our patient.